I am Dr. Pavitra Chakravarty. I am one of the pediatric consultants here at Bhagirathi Neotia, Mother and Child Hospital, Radharat, Newtown. Today we are going to discuss constipation. First thing is, how do you know that your child is having constipation? If your child is having very hard stools or is having a lot of pain while passing stools, you have to think of constipation. The other definition is, if a child is passing stools less than 3 times a week, you have to definitely think of constipation. Now, why is constipation, the diagnosis and management, so important? Well, constipation firstly can be the presenting fact for some other conditions, like there are conditions called like hypothyroidism, as you know, that can present as constipation. And there are numerous cases where over a period of time it has been diagnosed as hypothyroidism much later on, which has been missed. There are other medical conditions like conditions of the gut, like celiac disease or Hirschsprung's, which present early on and if not detected on right time can cause complications. Apart from these medical conditions, in small girls especially, recurrent urinary tract infections are found to have in those children, especially those children who are having severe constipation. This could be easily avoided if the constipation was treated. Number 3, there is also a condition called encoparesis. Encoparesis is a condition where a child with chronic constipation, the stool gets collected over a long period of time in the large bowel and causes a sort of blockage of the large bowel, and there is seepage or soiling of small amounts of liquid stool through the back. Now, this is a very embarrassing condition which can cause staining of the underpants, especially at school or when the child is going outside or when the child is going for a night out. It can be very embarrassing and can cause a lot of problems to the child. The other condition which is very common is a child having chronic abdominal pain. It's not been uncommon for a child to present a severe abdominal pain, and the child might have been mistaken or even thought of as appendicitis when it was found actually to be a cause of constipation. Or very often they can present vaguely as tummy pain, where the mother will say the child complains of tummy ache on and off for several months. That reason could be constipation. Lastly, not the least, is constipation can cause poor appetite, can cause nausea, and can cause bloating of the tummy. And ultimately, this will lead the child to have poor appetite, will lead to less intake of healthy food, and this will ultimately affect the growth of your child, it will affect the nutrition, and it will affect the general energy levels and well-being of the child. As you can understand, it is therefore important to think of constipation, and if you're suspecting it, needs to be brought to the doctor and treated at the earliest. Thank you.